Hi friends, my name is Dr. D. I'm intensive care doctor and created this channel to share fascinating and useful medical knowledge with you. Here I explain complete diseases, conditions, symptoms, and prevention in the simple, easy to understand why everything to help you better understand your body and your health. Subscribe to the channel and hit like button. Help me reach my first 1000 subscribers. Your support means a lot and motivates me to keep going.
Today we're talking about eczema. It's a serious topic that can't be explained in just a few minutes. So, if you're looking for a quick TikTok-style video with 3 magic tips to cure eczema, this probably isn't for you. But if you've ever dealt with eczema, you know it can bring hours, days, or even months of real discomfort. That's why I truly encourage you to gather your patience, sit down, and take 20 or maybe even 30 minutes, I'm not sure how long this will take, and listen to Dr. Sviderskiy doctor. It's very possible that you'll be able to help yourself. Let's get started. What is eczema? When it comes to eczema, one of the hardest questions is simply, what is it? Even reputable medical sources define it differently. Scientists still haven't come to a final agreement. A telling example: if you search for eczema on English Wikipedia, you're redirected to dermatitis, and it says dermatitis eczema, as if they're the same thing. The professional MSD manual also equates dermatitis and eczema but still refers to eczema as atopic dermatitis. This kind of confusion exists in many reference books and clinical guidelines. Back in 2004, the World Allergy Organization even recommended using the term eczema instead of atopic dermatitis. But not everyone agreed. The debate continues. In practice, the terms atopic dermatitis and eczema are most often used interchangeably. Dermatitis means skin inflammation. All eczema is a form of dermatitis, but not all dermatitis is eczema. For example, if a mosquito bites you and the area gets inflamed, that's dermatitis, but it's not eczema. The same goes for irritation from tight shoes. The word eczema comes from Greek. Exeo means to boil over or flare up, which reflects symptoms like redness and blisters. Definition: eczema is a chronic, relapsing inflammatory skin condition caused by a variety of external, exogenous, and internal, endogenous, trigger factors. Regardless of the cause, eczema manifests as an itchy, polymorphic rash, swelling, and redness of the skin. Every word in this definition matters. Eczema is long-lasting. It can last months, years, or even a lifetime, so it's called chronic. Symptoms may disappear completely and then return. That's relapsing. Triggers may be genetic, environmental, food-related, infectious, or due to substances the skin touches. These triggers cause flare-ups or worsen the condition. Itching is an essential feature. If there's no itch, it's probably not eczema. A polymorphic rash means a rash with many different forms: red patches, blisters, flakes, pustules, crusts, etc. Why it matters? Let's look at the numbers. Accurate statistics are hard to come by because, as you now know, eczema has no single agreed-upon definition. But based on estimates, 1% to 3% of adults worldwide have been diagnosed with eczema. 10% to 20% of children are affected. Overall, at least 3% of the population lives with some form of eczema. Main triggers. The mechanisms behind eczema are complex and not fully understood. Genetics play a major role. Your genes influence how your skin works, how it retains moisture, how it circulates blood, how it responds to hormones, how your immune system functions, and more. If one parent has eczema, the child has at least a 40% risk. If both parents are affected, the risk goes up to 60% or more. Common eczema triggers include emotional stress, immune disorders, environmental or physical stress on the skin, excessive dryness or moisture, friction, exposure to chemicals or allergens, heat or cold. Environmental factors: pollution, dust, extreme temperatures, harsh detergents, insect bites, infections, bacterial, viral, or fungal. Conditions like diabetes or poor blood circulation. Allergic reactions to food, medications, contact allergens, insect stings. Types of eczema. Due to so many triggers, there are many forms of eczema, each with its own characteristics and triggers. Some examples: atopic dermatitis, genetic, where the skin can't retain moisture. Microbial eczema occurs when skin broken by scratching becomes infected. Seborrheic eczema affects oily areas like the scalp. Varicose, venous eczema, due to poor circulation, usually on the legs. Occupational eczema caused by repeated exposure to irritants, e.g., detergents, cement, coal dust. Nipple eczema, often from breastfeeding trauma and infection, can also appear in teenage girls due to hormonal changes. Post-traumatic eczema, after surgery, burns, or under casts. There are many more. A specific diagnosis must be made by a doctor. Is eczema contagious? This is a very common concern. The answer is no. Eczema is not contagious. You can care for someone with eczema or atopic dermatitis without any risk of catching it yourself. End of story. Treatment. Let's move on to treatment. The first and most effective step is identifying and removing triggers. You or your doctor should analyze your symptoms. When they appear, what seems to make them worse? Food, clothing, medications, weather, stress, illness, hygiene, etc., and then try to eliminate the obvious ones. The second key step is proper skin care focused on moisturizing and restoring the skin barrier. Let me emphasize this. Proper daily skin care is a form of treatment. No medication will help if you don't protect and take care of your skin. You need to hydrate the skin and retain that moisture. That means avoid dehydration, drink enough fluids, maintain a comfortable indoor climate, bathe properly. Bathing tips: soak the whole body or affected area in clean water at 33 to 34 degrees Celsius, 91 to 93 degrees Fahrenheit, for 10 minutes max. Baths are better than showers, but a gentle shower is acceptable. After bathing, moisture levels in the skin are at their highest. This is the best time to lock it in. Do not scrub your skin. Use no loofahs, no rough rubbing. Add water-soluble oils for dry skin to the bath. Make sure they're sulfate-free. Use mild baby soap or cream-based cleansers, ideally unscented. Emollients. Emollients are external products, creams, ointments, that prevent moisture loss, soften skin, form a protective barrier, reduce itching, help heal small cracks and wounds. Examples: baby cream, plain petroleum jelly, both are emollients. There are many choices for different needs and budgets. Important: emollients don't contain active medications, are safe for all ages, and you can't overdose on them. Rules for using emollients: apply at least twice a day, especially after bathing. For very dry skin, especially in kids and teens, apply every 4 hours. Apply over the entire body, not just affected areas. Don't stop using them even when symptoms improve. Anti-inflammatory therapy. This usually involves topical steroids, glucocorticoid hormones in the form of creams, ointments, lotions, or emulsions. These reduce inflammation, swelling, and itching and help the skin heal. Only a doctor should prescribe them. There are many types and strengths, depending on eczema type, location, severity, and age. Some areas absorb steroids more, like the face, so weaker formulas are used there. Sometimes doctors prescribe one product for the face and another for the body. The bottom line: steroid treatment must be personalized and monitored by a doctor. Helpful tips. For intense itching, try cold compresses, gently stroke the skin instead of scratching. Wear thin cotton gloves at night to avoid scratching while asleep. Choose soft, breathable fabrics, no wool or heavy synthetics. Keep nails short. Stick to daily baths, emollients, hydration, and air humidification. Important note: eczema is not a contraindication for vaccination. Mental health and eczema. Lastly, let's talk about the link between eczema and mental health. Chronic itching, sleep disruption, and the way eczema looks can take a toll on your emotional well-being. Many people with eczema experience depression or anxiety, and it goes both ways. Emotional stress often worsens eczema. If you're struggling emotionally, don't hesitate to speak with a psychologist. Stay healthy and take the right steps.